India is witnessing a hospitalization rate of 5 to 10% in this third wave. Now, it depends how you look at it. If you were to say that this is exactly half or less than half of what we saw during the Delta wave, which was 20 to 30%, you wouldn't be incorrect. But the rate of transmissibility of Omicron means that the burden on hospitals is much larger than before. And therefore, even with a hospitalization rate of 5 to 10%, given the larger numbers of patients which we are seeing at this juncture or at this stage of the third wave, the possibility of our hospitals being overwhelmed is a very real concern. We've seen it happen in other parts of the country, I beg your pardon, other parts of the world, for example, the United Kingdom. And the real fear is that while India has stepped up our infrastructure to deal with COVID cases, it may not be enough to actually look or deal with the surge that we are looking at. That's the real concern. For every 100 Delta cases, there could be 400 to 500 Omicron cases. And therefore, even if the disease itself is milder than Delta, there will still be a large number of people who end up in hospital. For every 100 Delta hospitalizations, there could be 125 to 250 hospitalizations in the third wave.
The hospitalization, the numbers that we are seeing right now is just 5 to 10% for every 100 patients. 5 to 10 are getting hospitalized. The fact is this particular variant is also about 4 times more transmissible than the Delta variant, so which means that if we compare the sheer numbers with the Delta variant, while during the wave of Delta variant there were about 20 to 25 hospitalization taking place. For Omicron, if you multiply 5 to 10% into 4, which can mean 20 to 40 hospitalization, which clearly means that Omicron variant and the number of COVID patients that are coming up can in fact overwhelm any healthcare infrastructure in any city of our country. We have seen that on 21st December the positivity rate was just 0.2%. Today it's about 23% in the national capital, which can prove the number of the rate of transmission of this particular variant is extremely high, and we have to be on guard. As far as the guidelines by the government and the instructions by the government are concerned, the government has clearly asked not just for hospitals to be ready, they have asked all the COVID care centers to be converted into oxygenated beds as well, because in case oxygen requirement is needed for these patients, then it can be a critical situation for the hospitals. And not just the hospital beds and hospital infrastructure, the government is also asking the states to be prepared to keep healthcare workers on a standby. For example, the junior doctors, senior doctors, senior resident doctors have been asked to help the healthcare infrastructure to continue, because a number of healthcare workers are testing positive as well. Also, the government has said that they can also communicate, and if needed, MBBS third year students can in fact come and help in COVID duties. The nursing students who are doing their masters can in fact help with nursing duties as well. So not just the beds, it is also the healthcare workers that will be needed in case the number of cases continue to go up and hospitalization increase.